name is Hailey Marchel, and I completed my senior preceptorship at Tacoma General Hospital on the Adult Medical Surgical Unit. My capstone research project is titled Holistic Nursing Care in the Post-Operative Spinal Surgery Adult Patient. During my preceptorship, I cared for many spinal surgery patients in the post-operative period. There were a variety of spinal surgeries that patients were recovering from. Discectomies, laminectomies, and spinal fusions were among the most common procedures performed. When I was caring for these patients, I noticed there were many nursing interventions to consider. This inspired me to explore the holistic care among this population and to conduct research on best nursing practices. The literature reinforced what was being implemented on the unit and elaborated on standard post-operative care. The importance of assessing vital signs, level of consciousness, monitoring intake and output, and monitoring for signs of infection were all noted in the research. What I found to be most consistent across the literature was the emphasis on education, early ambulation, and pain management. I was reassured of the importance of encouraging ambulation during the therapeutic effects of pain interventions, as well as providing patient-centered education throughout their time on the unit versus only at discharge. When you look at my poster, I want you to notice the initial focused assessment a nurse on the med-surg unit completes when the patient is admitted to their unit from the PACU. Not only is it important to gather information from the PACU nurse about the patient, but also to complete an assessment that reviews the patient's current vital signs, level of consciousness, and surgical incision site. This provides the nurse with baseline patient data that addresses critical information. If at any time the patient deviates from their baseline during the stay, the nurse should quickly intervene. I would like to also highlight that the priority nursing diagnosis for this population is acute pain. Undergoing surgery can be physically traumatic to the body, and some incision sites are larger than others depending on the type of spine surgery. ICE therapy has shown to reduce inflammation at the surgical site as well as provide non-pharmacological pain management. With holistic care in mind, I wanted to research additional non-pharmacological pain interventions. I found other effective methods to include deep breathing, distraction, guided imagery, and music therapy. I want to emphasize the importance of reassessing in a timely manner after pain interventions are implemented. This enables the nurse to evaluate whether or not the intervention was effective and adjust the plan of care as needed, because it is important for nurses to be flexible with this plan of care. Additionally, patient education regarding nursing interventions and care throughout their time on the unit is key in patient participation and recovery. The main point to cover with these patients is the rationale behind early ambulation and the role it plays in decreasing respiratory complications, decreasing blood clot formation, promoting GI motility, and promoting healing. I found that the teach-back method is an effective way to evaluate the patient's understanding. Finally, I would like to thank my preceptors, professors, peers, and families in supporting me in my journey to becoming a nurse. Thank you for listening.